Hi everyone, Nurse Jess here. This is my first time doing a YouTube video. Hi everyone, this is Nurse Jess. My name is Jessica. I call myself Nurse Jess. So I am a first-time YouTube video maker. This is my first video. Just created my YouTube channel here. And I'm going to be talking anything nursing school related, anything my first year of nursing. I graduated last year in March, passed my boards in May of 2018, and went to ADN program. So it's an associate degree nursing program. Did not get my bachelor's, but in this video I'm going to be talking about, should you wait to have kids until after nursing school? I am currently 32 weeks pregnant, so I do get out of breath, so just bear with me here. But basically I'm going to be talking about, should you wait until after nursing school to have children, or should you just wing it and have kids? I'll talk a little bit about my story. My personal opinion, this isn't to persuade anyone. Everyone's going to do what they have to do, and children are a blessing. At the end of the day, they're the most amazing thing in the world. But hopefully you like this video, subscribe to my channel, and then if you have any questions, feel free to put them down below. All right, so with my story, I started nursing school 2016, and before that my husband and I had been trying to have children. We had been trying to get pregnant, and it was a hard time to get pregnant. And it's funny because when as I was starting nursing school, I was just kind of like, at that point, after trying for close to 2 years, at that point I didn't even care about anything. My family knew I was starting nursing school, friends knew I was starting nursing school, my friends in nursing school knew that I was trying to get pregnant, and everyone and anyone told me, just wait till you're done with nursing school, because it's crazy, Well, at that time we were going on, I think, 18 months of trying to get pregnant, and with that, it's really, really tough. Like, you're so heartbroken. All you want to do is be a mom, and at that time, I love nursing. I knew I wanted to be a nurse and everything, but I also knew I wanted to be a mom, and I didn't care when, where, how, and what the timing was. I didn't care if I was in nursing school or not in nursing school. So I start my first year in nursing school. I get accepted, and going into my second class during my first year, I find out that I am pregnant. This is my first child. I'm pregnant. I'm so excited, head over the moon. Like, I am just ecstatic. And in my mind, I'm like, it doesn't matter. Like, we're going to get through the first year of nursing school. I'm going to get through the second. Like, it just doesn't matter. I'm focused and I'm excited. And me and the baby, we're going to get through this. So, pregnancy was, I would say it was a good pregnancy. Nausea here and there, wasn't bad. And my body felt good. The only thing that I did have was being tired. I was tired. My head, it was foggy in my head. I definitely had the, what do they call it, the pregnancy brain, which I currently have now too. But otherwise, besides that, it was fine. I was happy. I was excited. My body I was just like ready for it, right? So first year is happening, and I'm coming to the end of my first year. And I have to tell you, it was a very difficult first year as far as academically. I struggled a lot in nursing school. And no, it was not the Prego brain, because even after I had my son, it was just it's a very difficult program. So add pregnancy to the mix, it's tough. So I'm coming to the end of my class of the first year, and it's mental health class, and I am 3 centimeters dilated with 2 weeks left of nursing school, and I can pop at any moment. And at this time, I just want to be done with nursing school. It's been very tough, academically wise, not the pregnancy wise, and I just wanted a moment to just breathe and just embrace my pregnancy and have a moment to just be me in my pregnancy, right? Because it's my first child. And then, what comes with that is you have to get the room ready, you have to get stuff ready for the baby and everything. So it's really, really tough. Definitely you have to have the family support, you have to have your husband's support, family support, anything, to really get you through those last few months, because it's not easy. So after that, I finished my last clinical day of mental health, 3 centimeters dilated, and my final is that Monday, the following Monday, because this was a Thursday, at that Wednesday, Thursday, and I end up leaving, and I'm like, yes, this is great. Well, that Thursday night, I end up going into labor, and I end up having my son. I think it was like a Friday morning. I messaged my teacher. I think we had class or something like that. I'm not sure. Or no, I was letting her know I'm going into labor, but I'm coming in on that Monday to take that final. And thankfully, she was understanding. But again, with nursing school, you never know. With your pregnancy, you never really know. Is it going to be a vaginal delivery? Is it going to be a C-section? Are there going to be complications? Things happen. And so those are some things that you definitely need to keep in mind as you are thinking about whether you should have children right before nursing school. Because nursing school, if you have a surgery, there's only so many days of clinical days that you can miss. There's only so many days of school that you can miss before you get dropped from the program. They're understanding to a certain point, but you still have to, there's a contract. You still have to, comply to what the rules are for the program. And, you don't want to do all this work, things happen, and you might have to redo the class or the semester or whatever the case is. It's just things to definitely keep in mind as you're, planning. So I come in that Monday to take my final. Did awesome on that final, probably the best final I had since I've been in nursing school, which was so weird because I had my son on a Friday. I studied for maybe about a day and a half for that final. I don't know what it was, but I studied as I was breastfeeding my baby, my newborn baby at home, and kicked that finals butt. So I did that. So it was a successful transition. I had the vaginal birth, no complications, had him. This is where the problem came up a little after. So 2 weeks after, my son ends up getting pyloric stenosis. And if you don't know what that is, look it up. I'll let you look it up. But he was basically vomiting at this point. It's Christmas Eve, and he was just vomiting and vomiting. I'm breastfeeding, I'm, doing everything I can. To the point where now he's becoming lethargic. So as soon as that started happening, we definitely rushed to the ER, and they did the x-rays, and they said, your son has pyloric stenosis. And let me just tell you, as a first-time parent with a 2-week-old, it is just devastating. First of all, I wasn't even familiar with the term, right? So they're explaining it to me. And they're just the doctor and the nurses were so sweet and very, nonchalant. They're just like, we do these procedures all the time. These things happen. Like, this is like a routine procedure. Like, don't even worry about it. It's not a big deal. He's going to be okay. We're going to transfer you to, a pediatric hospital. And as much as, they comforted me and tried to do what they could do, it was very traumatizing for me. Very traumatizing. One of the most difficult things that I had ever been through. seeing my 2-week-old, with an NG tube, because, he kept vomiting, every time I tried feeding him. And then also they had a very hard time with the needle stick, because he was just dehydrated. He was just, they had to bring in the scan to see where his veins were, and, because they were having a hard time, and it was just a very difficult time. So Christmas Day happens. He has his surgery, which took, I'm not kidding, like 20 minutes. It was like a 20-minute surgery. And, thankfully, thank God, everything was okay with him. He is a healthy 2-year-old now. But for me, it did do an impact on me. Something that you have to consider after you have kids, you become very mama bear. You really don't want no one to hold your kid, and it could just be me and some moms, not everyone goes through this, but you become very mama bear. You don't want no one to hold your kid, like who's kissing my kid, like you're very overprotective, right? So when something like this happens and you add that to the mix, it makes it even more difficult, because now you're not only mama bear and you're overprotective, but you are also now anxious. I was very anxious always. I remember sleeping and waking up screaming or whatever, because I would have nightmares that that my son died, or that, I was always worried that something else was going to happen. Like, okay, he got pyloric stenosis. What else could he get? If he sneezed, I was like, oh my God, he's getting sick. What's going on? At this point, I'm already 1 year into nursing school. So you already know how to do head-to-toe assessments or whatever, your pediatric, your basics in pediatrics. And that's basically what I was doing. I mean, I would check his temperature. I would look at the color of his body, of his face. If he looked a little yellow to me one day, I would be like, something's going on. Maybe, something's going on with his liver, jaundice. It was just very, very difficult and traumatizing for me. And at that time, I should have known that I shouldn't have. I say this to myself now. My husband says that, I did awesome for going back to school that following January, to start my second year in nursing school. But I feel as a mother, you need that moment to just kind of heal from the traumatic event that you had or anything going with your child. Because when I returned back to nursing school, we started touching, it was I don't know what I'm thinking. MedSurg 2 or MedSurg 1 is what we started. MedSurg 1, they started talking about IVs for pediatrics and IVs for adults. And they showed pictures like when they were attempting to do IVs on pediatric your patients, and how sometimes they were not successful, and the things they had to do to be able to get an IV done, and as I'm watching that on the screen, I am like, my anxiety started going up, my hands were sweating. I just wanted to leave the classroom, because it was bringing me back flashbacks from when they were trying to attempt to start the IV. So that was a red flag there, where now I think about it and I'm like, I shouldn't have gone back so soon. And it was very hard when I had to go back. I honestly did not want to go back to nursing school. I never wanted to leave my son's side, like ever. After that happened, I was like, that's it. I just want to be with my son, like 24 hours a day, 7 days a week. I don't need no one to take care of him. It's just him and I, and that's it, And my husband definitely had to have, a strong conversation with me, like, what's going on? You've been working so hard for this. This is what you always wanted to do. This is what you always wanted to be. Our son is fine. Our son is healthy. Our son is, tolerating, the milk, and he's okay. Like, he kept trying to reassure me, like, go back to school. You're in your second year. That's it. You got 1 more year left. And I'm thankful he did that. And in a way, I'm so glad I did go back. But in a way, I also feel like when I did go back, I went through a lot not only was it challenging academically now, but it was also challenging emotionally and mentally now. Like, I remember going to clinicals and missing my son so much, just missing him. And I pumped for my son. I did breast milk for his whole first year. So, I would take my pumping bag and I would pump at the hospital, at the clinicals, at school. And I remember just crying because I just wanted to be with my son. I wanted to go home and be with my son. And, it was just a really tough time. And I even think it might have been some type of postpartum depression. I'm not sure. I brought it up to my doctor and they say that it was just an anxiety from the traumatic event that we had gone through. But thankfully he is a healthy little boy. Everything went well. But it was a very difficult second year as well. So these are the things that you have to keep in mind. Hopefully your pregnancy does go well, but sometimes it may not, unfortunately. Hopefully your labor and, during the labor and delivery, that goes well and there are no complications. But unfortunately, things happen, even after you have your baby. Hopefully you have, a healthy baby and everything is fine. But unfortunately, sometimes things do happen, and then adding that to nursing school and everything, it is very, very difficult. So, if you were like me, very stubborn, and you just don't care and you're ready to take on this challenge, then go for it. If you are young and you're okay with waiting another 2 years till you're done or whatever the time frame is, then that's fine too. I was not willing to wait. I'm older. I wasn't in my young 20s anymore. And I think that regardless, at the end of the day, it was very, very difficult. It took everything I could give to get to my goal at the end. And I think that anyone that is truly, truly passionate in their heart and they want to get to the end, I definitely believe that you can, but it's going to be very difficult. And you have to have the support that, you have to have a good support, family support to get through it, because there will be days where you just don't want to leave your baby. Your baby may get a cold and you're just like, oh my God, like falling apart, because especially if you're a first time parent, but I think I wouldn't change it for the world. I am so glad still that I made the decision that I made. Did we go through very tough times, my husband and I? Yes, we did. Because on top of that, being mama bear and everything, you're kind of watching your partner like, well, I do it this way, that's not how you do it, and you're just kind of trying to tell dad how to do things. And I think it just happens with being a first-time parent. You just want to take control as mom, because mom knows best, right? But we laugh about it now, and I think those are just some things that you definitely just need to consider and see, is it the right timing for you and your husband? Is it the right timing for you and your family? Even if you have a toddler, I have my 2-year-old now. My son was 1 during my second year of nursing school. Is it the right timing to add another little baby in the family, if you're starting nursing school? So there's a lot of things that you want to just keep in the back of your head, keep in mind, so that it doesn't come as such a shocker. Because for me, I thought you get pregnant and it's, rainbows and butterflies. You go through the labor, you get epidural, you get through it, right? How hard can it be? And then you're with your bundle of joy, and how hard is that, right? But it is way, way, way more difficult than that. Hormones, oh my God, that's another thing. Hormones, postpartum depression, mood swings during the pregnancy, after the pregnancy, the labor. For me, I had the epidural, and It took me 3 hours to push my kid out, and by the time it was done, I felt like I got hit by a bus, and it took me a month to recover as far as my body feeling like I wasn't no longer hit by a bus. Like, it was just extremely sore. So it's just all these things that you have to just keep in the back of your mind. Children are a blessing. Babies are a blessing. They will change your life, and everything that you do is for them. But while you're thinking about starting nursing school, or you're in nursing school and you're thinking about growing your family, these are things that you definitely have to consider and truly keep in the back of your mind. Are you ready for it? And when you make that decision that you're ready for it, do it. And you will get through it. It'll be challenging, but you can definitely do it.